heart failure patients are often told to limit their salt intake. But does limiting the salt intake actually improve outcomes in heart failure? The data surrounding sodium intake in heart failure are contradictory, and as such, there's much confusion surrounding sodium intake in heart failure. Sodium is essential for life, but too much sodium can cause stiffening of the artery and fluid retention, and high blood pressure, and enlargement of the chambers of the heart. And these can eventually lead to heart failure and kidney failure and stroke. In fact, multiple studies have shown that by limiting salt intake, we can prevent high blood pressure, kidney disease, and stroke. This has been confirmed by demographic studies of civilizations that consume low amounts of sodium, in which high blood pressure and hence heart failure was found to be extremely rare. Among the best examples are the Yanomami people who live on the border between Venezuela and Brazil. The Yanomami have a mean salt intake of just 0.5 grams, and Yanomami men at the age of 50 have a mean blood pressure of only 100 over 64 millimeters of mercury. Our bodies require less than 1 gram of sodium per day to function properly. Today, in industrialized countries, the average sodium intake is 10 grams. In the United States, the average sodium intake is 3.4 grams. Given all the available evidence showing that high salt intake can cause strokes and heart attacks and heart failure and high blood pressure, many public health authorities around the world have recommended limiting sodium intake for optimum health. The World Health Organization recommends 2 grams of sodium per day for all adults. The U.S. Dietary Guidelines for Americans recommends 2.3 grams of sodium per day for all adults, which is about the same amount of sodium that is found in 1 teaspoon of table salt. The American Heart Association recommends 1.5 grams of sodium per day for all adults. But this is where the problem starts. Recent studies examining low sodium diets in heart failure patients did not show any survival advantage or any decrease in the rate of hospitalization of heart failure patients on a low sodium diet. In fact, in the sodium HF trial, the only advantage found in limiting salt intake in heart failure patients was symptomatic, as measured by the New York Heart Association functional class. Even more striking is that studies examining lower levels of salt intake in patients with heart failure demonstrated there was an increased risk of death in patients taking lower amounts of sodium than the recommended 2.3 grams per day. The jury is still out when it comes to a concrete recommendation for the amount of sodium to be consumed by heart failure patients. But given all that we know, it is prudent to follow the American Heart Association's recommendation of 1.5 grams per day if you have stage A or stage C heart failure, and in stage C or D heart failure, to follow the U.S. Dietary Guidelines for Americans recommendation of 2.3 grams per day of sodium. According to the most recent data, any restriction lower than that may lead to adverse outcomes. Thank you for watching. I'll see you in the next video.